Hello, this is Dr. Do again. This video is on alphabetic list problems. I finished the letter L, mainly on the lung diseases associated with like asthma, pneumonia, or other kind of lung diseases, and also I talked about the limb pains on the previous video. There's another group of important diseases of the liver diseases, but since I have talked about the hepatic diseases, so I put this liver disease in the letter H section, so I'm not going to talk more about this liver diseases. So move on to to start with the letter M. The first thing came to my mind of this is under the category of letter M, myocardial infarction. So because it is quite common, it seems probably there's nothing to talk about it because you probably already know it, since it is so common, so serious, and everybody know about this myocardial infarction. You probably heard it all the time, which is heart attack. But I still like to talk about this in terms of the pathological process, particularly the time, the critical time period of this reversible or irreversible process. So let me just, before I talk about that, let me just bring up the signs warranting emergency visit for this myocardial infarction. You probably know it, you heard it so many times. If you're young, you probably heard it from your grandparents or the neighbors, or if you're older, you probably heard or for yourself or from the neighbor, from the people around you. So anyway, what are the signs indicate might be the myocardial infarction? First of all, chest pain, particularly chest pain associated with the activities, walking upstairs, jogging for long distance, or shovel snows, or moving heavy boxes or something. Anyway, so this is the exertion of the exertional chest pain. That's what it's called actually, especially associated with the upper extremities activity like shovel snow, because of this the blood supply. The reason of the blood supply the upper extremity is different from the lower extremities, so cause this increase the burden to the heart. And also, like I said, jogging itself, because the whole body itself require more oxygen, increase the burden of the heart, so that's caused this chest pain, increase the chance of the myocardial infarction. And particularly the chest pain in terms of nature is really crushing pain, very severe, and radiated to the left shoulder or the left arms or the fingers. And just remind for those who have diabetes, this chest pain may be subtle or atypical, probably because of the neuropathy. Really, the pain is not quite sensitive for those diabetic patients compared to normal people. So this is just a little reminder for you. You probably know it. And the risk factors for this myocardial infarction, of course, if you have those risk factors, hypertension, hyperlipidemia, obese, and sudden develop this exertional chest pain, radiating to the left shoulder, crushing chest pain, cruciating chest pain, radiating to the left shoulder, left fingers, don't hesitate. Even though it's not, but even though probably if you're young, probably it's something else, but still do not take chance. Go to the emergency room as soon as possible. Is there any condition associated with this myocardial infarction you can manage at home? I think the answer is no. Of course not. You have to be managed by physician. Not only so, has to be managed in the urgent emergency situation. So, have talk about that. What is the myocardial infarction? We know the risk factors already mentioned, and what is it in terms of the pathological process? So we know the function of the heart is really to pump the blood, to infuse the whole body, to provide blood supply, carry oxygen for the activities, for the metabolism. And the heart itself, of course, requires the blood vessels to provide oxygen. Those are called coronary arteries. Different branches provide a blood supply to different areas like the septum, the apex, or the ventricle, or the walls, or the atrium, or the pacemaker sinus. So these are the fundamental knowledge about this heart. So this coronary artery, because in between this constantly contraction, dilation process, and also for those have risk factors, hyperlipidemia, hypercoagulation status, or diabetes. So this blood vessel undergoing the sclerotic change, or the cavity of this blood vessel start to narrow, or by thrombi formed inside of the blood vessel wall. So they narrowed the passage of the blood supply, and big enough to really cut off the blood supply to the heart itself. And in terms of the time, can be reversible within 12 hours if through the thrombolysis or the bridging, open it up, the muscle can recover in a big effort to recover it as new. I mean, no scar tissues. But beyond this 12 hours, that's really is reversible. So this, in terms of this, probably is not necessary, but I just ask you to imagine a tomato you had in the refrigerator for a long time. At the beginning, probably just focal area, a little soft, but it's okay. And you just keep it there, and the other day, a couple days later, it's really getting squishy. If you still do not take care of it, and then just if you squeeze, then just pop up. This is just a simple, straightforward example. You can imagine that. Probably not appropriate, but give you some idea. Because of this cut-off supply, ischemic on this cardiac muscle tissue, so then undergoing the damage and rotten, actually necrosis, inflammation. Rotten is the common word, but basically it's the pathological process is the inflammation, necrosis. And within 12 hours, like I said, if opened it up, blood supply back, and without the reperfusion damage, so can really recover. But with the long time, if it's irreversible, plus the free radicals cause a reperfusion damage. So it's really the consequence is severe. So that's why the time, if you have this chest pain, do not hesitate. Go to the emergency room as soon as possible. Time is really saving life, save the heart at this moment. So in terms of the risk factors, I talk about the hypertension, of course, and also the hypercoagulation state, either genetic or some medications, or some hyperlipidemia cause increase the viscosity of the blood, and any other diseases. So these are the factors, and also the activities, manage the activity in the appropriate level. And this should be guided by your physician, what kind of exercise after the test. And talk about the test, EKG or the treadmill or the challenge stress test, different kind of. So these are give the physician's idea about how, what the level of narrow of your coronary artery disease, or the function level of the heart. So this is in general before the myocardial infarction. It's very critical. So your physician had idea about your heart function level and can give you some recommendations, what kind of activity you can tolerate, or probably treat it before the point of no return, myocardial infarction. So this is about the myocardial infarction. It's so common. I'm pretty sure you know it, but just my video here just to give you a idea, use example to visualize what happened in the heart if you have those risk factors. I hope that you can be alert and pay attention to modify lifestyle and to improve. I'm going to stop here, and thank you for watching. I will see you next time.